I'm Dr. Pradeep Vaideeswar, Professor at St. G.S. Medical College and KEM Hospital. I have been associated with these institutions for the past 38 years. The Department of Pathology demands visual documentation of the various excise specimens along with taking photographs of all the histology slides. This has to be constantly performed because we have to cater to both undergraduate as well as postgraduate training program, and these images are also utilized for presentation at various conferences as well as for publications. We receive a large number of surgically excised specimens to the tune of 15,000 per year, along with autopsies which range from 1,200 to 1,500 specimens per year. For the past many years, we have been using cameras which had been mounted on a microscope. This had several disadvantages. The first one was we used to get a restricted field of interest. Along with that, the same image, when seen on the computer screen or when projected through the projector, especially for the undergraduate practical sessions, there used to be some element of blurring of those images. And this created a lot of problems for us until we discovered the Cilika microscope. As I said before, things changed when we had Cilika microscope. The first and foremost is that Cilika microscope has got a very broad screen where we could see the images. So that helped many of us who are getting little old. We have a problem with our eyesight. So it became very easy for us to see the area of interest so that we could give further instructions of what images have to be taken and what images need not be taken. That is number one. The second thing is that we sometimes are required to do a lot of morphometric analysis, or sometimes, especially with immunohistochemistry, there might be areas in which we may have to count the positive staining of the nuclei. So with this software which is incorporated in the Cilika microscope, it became very easy for us to do everything at the same time, rather than waiting and keeping it pending for a later time, and the things were extremely fast. The second thing what we also noted, that when we connected this microscope to a computer screen or through a projector, there was hardly any lag, and plus we could get the same crisp images that we observed on the iPad along with what we saw on the computer screen or on the projection. So this became very useful, especially when we are teaching a large crowd of students. For example, we have around 250 undergraduate students. We have around 43 of postgraduate students every year with us. So it became very easy for us to teach because what we could see live could also be seen on the screen. So that is an extremely distinctive advantage of Cilika microscope. And so far I have not been very happy with the other microscopes using the same principles like Cilika microscope. So finally I can say that Cilika microscope has changed the way we look at things, especially for teaching, and it has been a great boon for both the undergraduates and postgraduate students. And we have been getting a lot of prizes at our poster sessions that we have in a conference because all images are taken by the Cilika microscope.